Heart failure. You've probably heard the term, right? It affects millions of people. But honestly, it's one of the most misunderstood conditions out there. So, we're going to break it all down and explain what's really going on.
Let's start with a really sobering number, 50%. Roughly half of all patients diagnosed with heart failure won't survive past 5 years. That tells you right away, this isn't some minor issue. It is a massive public health challenge.
So when you see a statistic like that, you have to ask, what is heart failure, really? That's the whole point of this explainer. We're going to pull back the curtain and demystify this thing piece by piece. First things first, let's just get a sense of the scale here. Because this isn't some rare, obscure disease. It is a widespread challenge, and it affects a staggering number of people.
The numbers, well, they really paint a picture. In the US alone, you've got about 5.1 million people living with it. Every year, another 650,000 people are newly diagnosed. It's the main reason for over 1 million hospital stays a year. And the cost? We're talking over $40 billion annually. And you can bet that huge financial cost hides an even bigger personal cost for patients and their families.
All right, so to really understand what's going wrong, let's think about it with a simple analogy. Your heart is a pump. It's the most important pump in your body. And heart failure, at its very core, is a pumping problem.
So, the official definition is that it's a condition where the heart just can't pump enough blood to keep up with what the body needs. Now, this is absolutely crucial. Heart failure is not a heart attack. A heart attack is sudden. This is a chronic condition where that vital pump just gets weaker and weaker over time.
So, the big question is, what happens when this essential pump starts to lose its mojo? You'd think the body would have some brilliant backup plan, right? Well, the reality is a lot more complicated. And honestly, the body's fix actually makes things worse.
Okay, so when the heart's output drops, the body basically freaks out. It hits this big red panic button, firing up emergency systems, like the one that controls your fight or flight response. These systems try to solve the problem by making the body hold on to fluid and by squeezing the blood vessels tighter. But for a heart that's already weak and struggling, that is the absolute worst thing you can do. It creates this vicious cycle where the body's attempt to help just puts more and more strain on the heart, causing more damage over the long run.
Now here's where it gets interesting. Not all heart failure is the same. You can pretty much break it down into two main types. And it all boils down to one simple idea. Is it a problem with squeezing the blood out, or is it a problem with filling up with blood to begin with?
So on one hand, you have what's called HFrEF. That stands for heart failure with reduced ejection fraction. Think of this as the squeeze problem. The heart muscle is weak and floppy, kind of like a worn-out rubber band. It just can't squeeze hard enough. On the other side, you've got HFpEF with preserved ejection fraction. This is the fill problem. Here, the heart muscle is stiff and thick, like a hard water balloon. It can't relax enough to properly fill up with blood between beats.
And listen, this isn't just some textbook distinction. It is critically important for treatment. Doctors absolutely have to measure that ejection fraction, which is just a measure of pumping ability, before they start any kind of therapy. Why? Because the way you treat a squeeze problem is different from how you treat a fill problem. You've got to know which battle you're fighting.
Another key thing to remember is that heart failure doesn't just happen one day out of the blue. It's a progression. You can think of it as a journey. And experts have actually mapped out 4 distinct stages to track how it develops over time.
So that journey starts at stage A. Here, you're considered at risk. Maybe you have high blood pressure or diabetes, but your heart is still structurally normal. In stage B, there's been some change to the heart, maybe from a previous heart attack, but, and this is key, you still don't have any symptoms. Stage C is when the symptoms finally show up. This is usually when people get diagnosed. And by stage D, the condition is very advanced. You've got severe symptoms even when you're just sitting still, and you need some pretty specialized medical help.
Okay, so we've covered what it is, why it happens, and how it progresses. But the story does not end there, and this is the hopeful part. While there isn't a cure for heart failure, it is a manageable condition. So let's talk about what the goals of therapy actually are.
It's really important to get this. Treatment isn't just about making someone live longer. It's about making their day-to-day life better. The goals are to reduce those tough symptoms, to keep people out of the hospital, to slow down the disease itself, and yeah, to improve their overall quality of life.
So how do you do all that? Well, there's no single magic bullet. It's a whole strategy working together. Lifestyle changes, things like diet and exercise, are a massive piece of the puzzle. Then you have medications. Diuretics help get rid of that extra fluid, and other drugs work to block those faulty panic signals from the body, which reduces the strain on the heart. It's a combined effort, all designed to ease that poor heart's workload.
So, if there's one thing to take away from all this, it's this. Heart failure is, without a doubt, a very serious diagnosis. But it is a chronic condition that can be managed. And for everyone involved, patients, families, all of us, understanding what it is and how it works is the absolute first and most powerful step.
And that kind of leaves us with one final thought to chew on. We've seen how this disease progresses, right? It starts with risk factors, long before there are any symptoms. So knowing that, what's the single most important conversation you could have with your doctor about your heart health right now?